Welcome to the Coffee and Counseling Podcast, where two licensed psychotherapists give you their unfiltered opinions on mental health, wellness, life, and everything in between. It's real, raw, and ready to challenge what you think you know. Get ready for some tough love. Before we begin, just a brief disclaimer, this podcast is for educational and informational purposes only and does not take the place of therapy. We hope you enjoy today's session. Hello, everyone, and welcome to today's session of Coffee and Counseling, where we don't spill the tea, but the coffee will be piping hot, where we talk about all things counseling. We're your hosts, Rachel Steinhardt
and Stephanie Van Schaick. And let's be real, people are so curious about what really happens in therapy and what goes through a therapist's mind. Do we judge you? Do we think about you outside of sessions? Do therapists cry in sessions? We're answering it all today, pulling back the curtain on the questions you've always wanted to ask. So grab your coffee and let's get into it. Rachel, what is one high and low of your week?
Okay, so based on the timing of this recording, which whenever this gets released, I feel like people are so confused at this point as to when things are being recorded. But we just finished the holidays, so it was really nice. It was really beautiful. But I'm so tired. I'm so tired. But it's good. I really think it's a high, when you feel, at least for me, like that time to really reflect on our new year and who we want to be and who we want to grow to be and how we want to be better. It's so healthy, even in a mental health space, just like that reflection, Judaism aside, Rosh Hashanah aside. It's such an incredible thing to have these days dedicated to, our version of New Year's instead of kind of like getting drunk and partying at all hours of the night, which, don't get me wrong, people drink and people eat and we have a great time. But it really is about like meditating on your life and where your life is going and who you've been and what you want to improve on and your relationship with God, and just kind of like pressing the reset button on your life and picking things to really focus and work on throughout the year. And I just find it to be such an incredible thing and is so wonderful for growth. So I always really appreciate that time. And even though sometimes it can be hard because you're also looking at the things that you're not so proud of, I think there is a healthy balance of, I feel guilty about this, or I wish this didn't happen, but how can I do better next time without holding on to shame? It's very, very much an anti-Jewish concept to hold on to shame, because it just ends up being like, an endless spiral that doesn't help you. But anyway, loved that. And I guess the low is just that there is a lot of house chores waiting for me at some point that I need to get to. But thank God, no major low. But what about you, Steph?
Yeah, well, definitely I get it whenever there's holidays and it's so much fun, or, whatever it is, just enjoying it. And then all the things that you need to be doing kind of shifting to the back burner. Yeah, and it's because it's not a priority in those moments. But then it's like on the back end, it's like, oh boy, now I have to like re-enter life again and get going.
Oh my gosh, the laundry is so real. I don't even want to talk about it. But anyway.
Yeah, well, with 3 kids for sure. So my high, over the weekend, we met up with my sister and her family for one of my niece's birthdays. Yeah, we went to, it's so funny because, as you know, Rachel, she lives closer to you, and I always like mess around with her and say like, oh, let's meet halfway in Orlando, even though it's totally closer for me. And she gets so flustered every single time. She's like, it's not halfway. And it's like, I always like, it's just so funny because we always like kind of tease each other with that. And I'm like, no, we'll meet halfway in Orlando. But we met halfway, quote unquote, in Orlando, and went to the Crayola factory, which was so fun. And
my gosh, that's great that you went. I needed to ask someone how that is, because I've been like thinking about, it keeps popping up all over. I guess like the internet knows I have kids, and I'm like, is this like worth it? Is it cute?
It is. I mean, there's a lot that you can do there, and for adults and for kids. And I think it's like relatively a good value for the money. It's not like a Disney World ticket or anything like that.
Right.
So, I mean, it's definitely worth it at some point. It was a lot of fun. Yeah.
Okay,
So
duly
that was
noted.
nice. It was nice seeing them, nice doing that. We stayed overnight in Orlando. And I guess it would kind of relate to my low. It's just like getting back anytime. I'm such a creature of routine. And it's really something that I'm working on because I know I talk to my clients about this all the time, having flexible structure and all of that. And I do because I do push myself to do the things that push me out of my routine because it's necessary and important as well, but it's always a little bit of a shock to get back into like doing the things because like, I wasn't able to catch up from the week before that I normally do on the weekend or prepare for the weekend as I normally do. So it's fine. It was just like a day or so of like, okay, getting back on track, which caused a little bit more stress. So I would say that's probably along my low. I mean, nothing too crazy, but it was overall definitely worth it.
I'm so
So
happy.
yes, let's talk about why we wanted to cover this topic. Just a couple of quick things. Therapy can really feel mysterious and intimidating if you've never been in it before, or you're just kind of starting out and not really knowing what to expect, not knowing what a therapist is like. And it seems to me that just being out here in this space that a lot of people are really curious about like what happens behind the curtains. Like therapists are kind of like teachers now. If you think about when we were in elementary school and younger, we always just thought teachers didn't have a life. They taught. That's what they did. And but if we did think that they had a life or were humans, like we were really curious about that, and it just never seemed like we understood what that was like. So I think that people are just naturally curious about therapist perspectives and who therapists are and what happens on their side of the therapy um, relationship. So people can be often nervous to ask some of these questions out loud. So we're hoping to answer them, have a little bit more fun in today's session as well. We're pulling back the curtain and asking some of your most common and sometimes the juiciest questions that clients have about therapy and therapists. Do therapists judge their clients? Is our first question.
Okay, do therapists judge their clients? I don't like the word judge. I think that a therapist that pretends that they're not human and they're not going to have their own thoughts or opinions or emotions on anything that a client says is bogus. Like, I'm sorry, any therapist who tells you like you can tell me anything and like I'm a blank slate. No, you're not. You're a human being with thoughts and feelings. You have the ability, part as therapists, we have the ability to separate it from ourselves. We have the ability, and one of the things that I think really makes a good therapist is we're such empathetic, not all therapists, but the good ones, I think we're very empathetic by nature. One of the reasons a lot of us go into this field is because we are that way. We have that skill. And so I think a lot of the times that we hear things that other people might be quick to judge, we're quick to not even necessarily analyze, but come up with potential reasons as to why that may be the case or why that may be happening, or get curious, like, wow, like this is something they're thinking or feeling or experiencing. I wonder what story that they've lived through got them to this point, or like what is their thought. But don't get me wrong, like I've had sentences said in my session or like situations where I was like, okay, let's navigate this together, um and depending on the rapport you have with the client, I don't think it's judgy. I think it's almost more like, sometimes I'll work with like older teens or young adults, and it's more of that like playful mentorship conversation where they'll tell me something that they did that they know that is not good for them or not supposed to do, and I'm like, okay, what on earth? Like, why? And it's not coming from a place of judgment. It's just coming more from a place of like, I guess I'm trying to make light of the situation while also holding them accountable, if that's a better phrase to use. So that's the thing. I think is we do have our thoughts and opinions and reactions that is not necessarily, you know, completely unaffected by anything a human will tell us, but I don't like the word judge. So I don't know if that answers the question.
Yeah, so I was thinking that too when I read the question, that I think that judgment and judging has such a negative connotation. And unfortunately, because of that, then it makes it really hard to separate out what we're really talking about. First and foremost, I think you landed on something so important, Rachel, when you're like, we are human beings, and human beings are judgmental creatures by nature. Now, again, the negative connotation is going to sound like that's a really awful thing, but we have to judge. Like, it's for our survival. We judge our surroundings. We are
Mm-hmm.
constantly making judgments around us. So when we talk about judgment in this sense, though, when we're judging you as a person or anything like that, that is not something that's happening, because we understand, like Rachel was saying, that there's probably other factors that have led you to this point and led you to this place. And that's what we're exploring. So we're not secretly going out and being like, oh my gosh, can you believe what this person said to me, or what I had a client say to me, or we're not grossed out by you or disappointed in you, or anything like that. So that's really something that I hope anyone takes out of this, is that we are meeting you with compassion, doing our best to be neutral, and really is like a role that we can step into, or we're trained to step into as human beings and human therapists, and managing our human reactions. But you wouldn't want someone who absolutely had no thoughts or human reactions, because then you might as well talk to a computer.
Absolutely. And I will also add to this point, as Steph was talking, I was thinking about this. Like, there's also a reason that people have like the first session and people have consultation calls, because if someone's saying something and you internally, as a therapist, as a person, you're hearing things that you're like, I just can't remove my bias from this
Mhm.
conversation, or like, this is an issue that like I'm just not equipped to deal with. Part of, being an ethical practitioner is removing yourself and saying, I think somebody else may be better equipped to work with you, and helping that person find a therapist that might be a better fit. So it's, again, I'm not even necessarily saying that the proper word for that is a judgment, but I think maybe the therapist might judge the situation and say, hey, I don't know that this is the best fit for me to help this client, considering what it's bringing up for me and what the client just said. So if you're working with an ethical, you know, practitioner that's practicing the way they're supposed to be practicing, and you're still seeing them and you've been telling them all the things, it's safe to assume that you're on safe grounds. And a therapist that's functional and knows what they're doing and ethical, and I don't even know, like, just a good person, for the love of God, like,
Yeah.
is going to be able to say, this is just not for me, and you deserve better than working with me when I can't give you the best care that you can get. And that's part of our, ethical and moral code working with clients. The same way that a doctor who's like an orthopedic surgeon is not going to help somebody that has an eye issue, like,
Mhm.
and I think that that's just part of it. So, be as it may, the way that you utilize the word judge, I also don't like that word, because I feel like it puts people in a position of authority, and we're not in a position of authority at all.
Mhm.
But yeah, I hope that answers the question.
Well, it's good perspectives here. I think it did.
Steph, do you think, and this is a question we get all the time, I did a post about this, but do you think about your clients outside of session?
Yes, we do. So here's the thing. We're hopefully, most ethical therapists are not just like thinking about any person in a weird way or an obsessive way, or constantly thinking about their clients or anything like that. However, there are absolutely appropriate ways that we can be thinking that, oh wow, like I know it just turned 5, and I know that this client had an interview, and I'm really excited to hear about it in our next session. Or you might think or be really worried about a client and how they're handling something, and sending positive wishes toward them, praying for them. So I would say absolutely, we can't just turn off our humanity and just be like, well, it's not the same as a typical job, but like where we could just say, well, we're done, and 5 o'clock hits and we leave, and it's all over. We do develop a positive, healthy, therapeutic relationship. So it is natural that you cross our minds, or there's a meme that it's not appropriate for a therapist to be sending memes to clients, by the way, but there's like, oh wow, this really reminds me of this client. And sometimes if it's appropriate in our next session, I'll say, oh, by the way, I just heard something, or I saw a meme that just reminded me of you, because I think it's also a nice thing when clients might be struggling, and recognizing that there are people who do think about them and care about them. And just knowing that, like, oh, hey, my therapist thought about me for like 2 seconds outside of me, the time that I pay her to do so. I think that's important for people to remember. Obviously, we need to be very mindful of what's appropriate and having boundaries. Like I kind of already mentioned, that we're not going to be sending you memes or anything like that. We have to be very mindful about that.
Yeah, and I will say this, not to sound like a Debbie Downer, and I want to be very clear that this is not whatsoever coming from a place of hate. It's just like a reality. A
Mhm.
lot of the time, private pay therapists will tell you, like, you get what you pay for. If you are seeing a therapist who sometimes may be taking insurance or is working with a larger, excuse me, organization, company, whatever, and they're seeing anywhere between 30, 40, crazy amounts of clients, that level of being able to spread yourself thin only goes so far. And so in that situation, they might not be thinking of you outside of session because they're on such like an overdrive of work and they're so overwhelmed that they're being stretched as far as they can be stretched. And so I think that that's an important thing too, where that is something that, again, I'm saying generally, this is not all the time, but a lot of the time when you are dealing with a therapist who's in a private practice setting or a private group setting, one of those just like smaller businesses, part of what you're paying for, if we're going to be really blunt about it, is just the fact that we are not overworking ourselves into the ground, hopefully to the point where we don't even have enough brain capacity to like remember your story or remember your names. Like I always tell Stephanie, I really just write notes for the fact that we're supposed to write notes. I don't need to, because I remember every client's story so well. I remember, the situation and what we left off on. Sorry.
Mhm.
And that's something that as you go into different spaces, you get a little bit less of that like individualized attention. And so because we have that space to hold you and your stories and your traumas and your whatever, our brain has that capacity to then go outside of session and we're still cheering you on and hoping for you and praying for you and thinking of you.
That is such a good point, and really thank you for bringing that up. All right, Rachel, have you ever been shocked by what a client has told you?
Yes, I have been.
Mhm.
Not shocked necessarily in a way where I'm like, oh my God, what do I do with this? But shocked in a way of, listen, there's a first time that you hear everything, right? And so a more seasoned therapist will tell you, we've heard everything under the sun, like try me. And it's true because at a certain point you've heard enough stories, but there was a first time for everything. So
Mhm.
I've definitely had um, first time situations with certain things that were brought up to me that I was like, wow. Or
Mhm.
sometimes a lot of it is coming from a place of I'm hurting for the story that the person is telling me. Like they'll tell me something and I'm like, I cannot believe that you expect. I'm so like, wow, I'm so sorry. That's so horrible. So there's like a shock with that.
Mhm.
But again, it's not like it doesn't. I think it's the same way that I feel about the word judge. It's like
Yeah,
it doesn't necessarily need to be taken in a negative context. It's just the human experience of the first time you hear or see something or experience something that is above what is everyday life. You're going to have like a shock factor to a certain degree.
sure. And I think that something to add in here is that I think that a lot of clients who anticipate that something they're going to say is going to shock the therapist, the client ends up being kind of shocked that it's not something that we've heard. Like it is something that we've heard before.
Right.
So, for an example, especially when it comes to eating disorders, an eating disorder can really morph the mind of the person who is struggling with the eating disorder. And when I say, I could probably say I've heard it all. And when a client's like, I don't know if you heard this before, I'm really nervous to tell you this and that, and they share it with me and they're having a hard time like fully putting it into words, and then I reframe it back and be like, yeah, if I had a penny for every time I've heard this, I want you to know, like, and I'm saying this not because to minimize, not to minimize what you're going through, but rather to help you understand that it actually is so much more common than you might think.
Right.
So on that note, and what I would say too, I feel as though for myself personally, I've gotten pretty seasoned really early on. One of my early experiences when I was actually in college, I wasn't even in grad school yet. I was interning at a rehab facility for drug and alcohol abuse. And the stories that you will hear in there will really sit with you. I remember just being done with the day and like, oh my gosh, like
Yeah.
I don't even understand how someone could handle the things that they handled and gotten like it was just mind boggling. So I would say that
100%.
the shock probably really happened there. And then after that, a lot of things aren't as shocking, but I'm
That's
sure.
actually such a good point, Stephanie, because a lot of us did our internships in places that are much more intense
Yeah.
than where we're currently working, or like the dynamic of work that we've currently set up for ourselves. And so by the time we're out of internships and we're licensed clinicians, we kind of have heard it all. Like we've
Mhm.
heard some of the craziest stories, been in some of the craziest situations, because as an intern, not everybody, but a lot of people as an intern, we get thrown into like the cockpit. I always think of like in Grey's Anatomy, like the trauma pit, and they
Mm.
bring everyone out of the ambulance. I don't know if anyone watches like any of those shows, but like there's the pit where all the ambulances come through, and that's like the craziest, most high intensity, it's the emergency room. And I'm like, that is our internship time. We're in the emergency room of crazy stories and like things that would shock the average person. And then when you come out of your internship, you're like, all right, bring it on.
I'm ready for anything.
um, yeah. But to shift it, question for you, Steph, have you ever cried in session? And do you think that it's okay for therapists to cry in session?
Mm. So I have not gotten to the point of actually crying in a session, and I hope that I do not, because I think that most people have other people in their lives that are ready and able to cry with them, and there's a help to that in those
Mm-hmm.
types of relationships. However,
Mm-hmm.
when you're coming to a therapist, it's I just don't find it would be very helpful for me to be
Mm-hmm.
sitting down and crying with you. Now, with that being said, I am human. I have gotten very close. I have gotten to the point of tears and really trying to bring myself in and bring myself together, because that is not what my client needs in that moment. I could save that for after if I still need to process whatever happened. It doesn't happen too often. It usually is when there is an unexpected death, or like the death of a pet, or something that just wasn't supposed to happen like that,
Yeah.
or was kind of shocking, or when I have had the moments where my client is just presenting in that moment as they're just breaking. And that breaks my heart whenever there's a moment like that, and the tears are there. And so I would say that obviously as therapists, we need to be mindful about how we bring our emotions in, because what we're trained to do and what's also helpful for you is that we can understand and help you in what you're feeling, but it's not helpful for us to take on the emotion as if we're feeling it ourselves, because then that's going to make us in a more muddy situation that we're not able to help you in the way that a therapist can help you. Hopefully, again, you have other people in your life that's ready and willing to sit with you and cry if that's what you need. But a therapist is something different than that. What do you think, Rachel?
This is a hard question.
I
I,
know.
I I think there's one point that I think is very, very simple to answer, which is full blown crying. No, a therapist should never be doing that. Like your client doesn't need to be taking care of you. I do think there's a difference between like someone says something that's so heartbreaking and a tear streams down your face. I
Mhm.
think there's a difference between that and crying, like full blown crying.
Good point.
Um, and so, coming from, I'm like hyper empathetic, like hyper empathetic. So when clients take me down memory lane or talk, like say a story to me, I really experience it with them in that moment. So I've definitely had my eyes well up or like have shed maybe a tear. I've never cried in session,
Mhm.
but like I've definitely gotten to the point where like after session maybe I needed to,
Mhm.
or during session I was like, Rachel, swallow your tears, because I don't want to, I also like don't want to start breaking down in front of the client.
Wow.
But I do, I think of myself like, how would I feel in the room? And I think if I was saying a really heartbreaking story of something I lived through and my therapist was shedding a tear or two, I think it would actually make me feel really good and really validated that someone sees me and feels my pain and is truly listening. And just like, when they say, I'm so sorry you experienced that, they're not just saying it off a script. They like genuinely are hurting for you.
Mhm.
And so I guess like I'm somewhere in, I am like team what you said. I agree
Mhm.
with you, but I think there's a little bit of space to show a drop more emotion maybe than you would maybe feel comfortable with.
Mhm.
Um, but that's also just because like I think about what would make me feel good in the other seat, and that's something I think about a lot. Like if I were the client right now, what would I appreciate that is still within ethical boundaries and healthy and helpful to the client, and safe. And so, yeah, I think that's my answer. Like crying, no, getting really sad, holding in, like you said, like swallowing back the tears,
Mhm.
shedding a tear, I
Yeah.
think is okay. Crying, I'm with you. No, no, like they do
Yeah.
not need to be taking care of you. No.
Well, that's a really good point to distinguish in there as well. And obviously, therapists, we can't be like stoic, not having any type of emotions or emotional reaction because, obviously we want to be very mindful of how that comes across, but we need to be human and remain in our humanity while we are treating our clients.
Right.
So, another point in that too, it's from the therapist angle, we have to be mindful because we are dealing with so many people's stories, and it could be really, really crushing if we take on everything
Hmm.
as if it's our own. And that's something that I remember in grad school, they just like really hammered in like the boundaries and the self-care, because I personally, and I think that a lot of therapists, and Rachel, you can let me know if you agree with this, that
Hmm.
if we take on too much of it, then we start to become more paralyzed and then unable to
Absolutely.
actually perform the jobs.
Absolutely. Absolutely.
Mhm.
I think every person has to navigate that emotional balance in the way that works for them. 100%. A hundred
Yeah.
percent. You can't, that's also why even thinking of them outside of session has to be limited, because you can't merge your worlds. Your work life has to be your
Mhm.
work life and your personal life has to be your personal life. And yeah, like I always say, whenever I go to like my other versions of I like make jokes like my other versions of temples. My other happy places, like when I
Mhm.
go to Ross or TJ Maxx or Marshalls or whatever, and I see like a mug or a random knickknack, or like just like a random thing in the store, I'm like, that's always something that will remind me of a client. And I
Mhm.
always want to take a picture and like send it to
I
them,
know.
but it's obviously like not an ethical. But sometimes I take the picture and I show them during the session. I'm like, I saw this and I thought of you.
Mhm.
But or
Totally.
and I've been open about this on my social media too, and I pray I definitely keep my clients in mind, especially the ones who really need prayers, who are stuck in horrible situations and health problems and abusive situations, whatever it is. But aside from those two things, I'm not like sitting there thinking about it all the time, because I can't, because that's not healthy and that's not helpful, because then I can't show up with the right amount of like R&R to be there for them when we're in our next session.
Right, right. So, okay, our next question, Rachel, have you ever disliked a client? I know that we've got this question a couple of times, so it's something people are very curious about.
Have you ever disliked a client? I've had clients where they didn't respect boundaries.
Mm-hmm.
I'm I'm like clearly very emotional, but I am actually very strict about boundaries because I just think it has to be there to protect you and to protect the client. So when clients do not respect it, I give them warnings. And if they literally just, it's not happening, I we will discontinue therapy. So
Mm-hmm.
I don't say that I dislike, it's not that I would dislike a person.
Mm-hmm.
Sometimes I realize that the situation's not working out. Um, Clients have definitely said things to me that my own personal beliefs or thoughts or whatever don't align with it. So I don't like the thing that was just said. But I don't think I dislike it. I think something that's really wonderful about being a therapist is we get the whole picture of the human. And when you get the whole picture of a human, it's a lot easier to give that person the benefit of the doubt, like understand them for who they are, take them for who they are, just like respect the human experience, which I think something in today's world we're truly, truly lacking. You know, I know a lot of the time there used to be this commercial. I don't remember what they were even selling or when it stopped, but there was this incredible commercial where there were like people in an elevator and like coming in and out of a situation of like an office or whatever. And every single person on top of their head was like floating a little like sentence about what that person is going through.
Mm-hmm.
And at the end of the commercials, like you just never know what the person next to you is going through, and like just be kind to each other. I don't know why this commercial was ever a thing. It was amazing and I loved every minute of it, and then it went away. But it's something I think about all the time. Like every single person is carrying something. Every single person is going through something and you don't know what that is. And so when a client says something to me that doesn't sit with me or I don't like it, I just think about like there's a person outside of the sentence or the specific thing that I don't like. And that kind of brings me back to the episode that we recorded on Charlie Kirk, where it's like we have to learn to agree to disagree. And you don't have to hate somebody because there's a part of their world that doesn't align with a part of your world.
Mm-hmm. That is so. I was thinking of that session that we recorded as well when you were talking, and it's such a great point. And one of the things that I love about being a therapist is truly being in such a privileged position that people are willing to be so vulnerable
Mhm.
to share every part of themselves. And it's really humbling too, as a human being, then outside of the therapy world, to recognize that, wow, I wildly disagree with this person, but I understand that we probably went through different pathway, like different lifestyles and pathways, and I understand why that person might think the way that they do, even if I completely disagree, even if I think that it's actually a bad thing, that
Mhm.
what they're thinking or doing or whatnot. Um, so I think we really do need to remember everyone's humanity, but it's a lot
Yeah,
easier in the therapy room when someone is showing you that,
totally.
because we are then, very defensive outside in the world and whatnot. And a couple other, well, I want to say I have not been in the position where I disliked a client or disliked someone who I was seeing as a person or anything like that. I think it's a great thing that you point out, Rachel, like, oh, there might be some things that it's like, oh, that doesn't align with my worldview, but that's not what we are in the room to do. Now,
Exactly.
for a therapist or a client who might be struggling with the like part of it, there might be something else going on. So there's something called transference and countertransference in the therapy room that can happen. Transference is when the client is almost treating the therapist or interpreting the therapist as like a different role in their life. And this could be like a whole session in and of itself. So I'm going to try to put it in a nutshell. Let's say if the client had a really not so great mother figure, and you are working on the inner child work and trying to reparent yourself, the client may then kind of view you in a way as their mother figure. And then there's a transference that can happen in that, because it's you're not their mother and they're not
Mhm.
your child. Now, countertransference is the same thing, just in the opposite way. So let's say that a client is bringing something to you that maybe saying something about a relationship that you were on the receiving end of at one point in another part of your life. Then you might start, oh, wow, you're the mean girl from high school. And if that's something that you are putting onto that client, you might start treating them a little differently. And maybe that is something that's going on, which is something not good. It's something we have to recognize when transference and countertransference is happening, because you really do need to put the kibosh on it. Or if you can't, then be the ethical therapist and get them to a therapist who can see them as a client and in a healthy way and help them in a healthy way.
Yeah. I feel like a good way to put this is like if you've ever been to a networking event or, let's say a friend brought you to hang out with a whole other new group of people that are potentially friends, or you went on a date, there are going to be people that you're just like, you're not my cup of tea, but like,
Mhm.
okay, I don't dislike you. You're not like, I have nothing against you. You're just not my cup of tea. I think we've had clients that are maybe not our cup of tea. And then we, on the other end, have clients where we're like, if you weren't my
I would
client, we
totally be
would
friends with
totally be
you.
friends. We would totally be friends. So I do think on that type of a spectrum, there's ranging emotions on how you feel about a client. Like, I'm not going to lie, there's definitely clients where I'm like so excited to talk to. And then there are clients where I'm like, okay, like this is fine. This is great. This is part of the job. I'm excited to help this person and have a productive day of work.
Mhm.
But again, that's human nature. And I'm sorry, but therapists who deny that, you're,
Just
you're
watch
not
out.
telling the truth. You're just not like.
Which is why we're here, to actually tell you the truth, and we value you. And I'm not saying they don't, but we value you enough to be honest
Brutally
about
honest.
these things, because I think that we all can get the sense that when someone's kind of BSing us, and it's not helpful. Like, I won't trust
I don't
people who I'm
appreciate
like,
it. Yeah, for
yeah,
sure.
exactly.
Okay. Really popular question, Steph. Do therapists go to therapy too?
This is a very popular question, like you said, Rachel. So, yes and no. So, it's just like in the regular population, there are people who go to therapists, and there's people who are not going to therapy. I know that in grad school, they really promote the idea of therapists going to their own therapies and being taken care of in that way.
Hmm.
I don't think it's necessary, though, unless you are going through something as a therapist that requires you to get help outside of yourself,
Hmm.
or if you prefer that you want to see a therapist. But I think that the problem when we're promoting the idea that all therapists should go to therapy is, then there's a couple issues. Is that one, people might want to find out whether or not you do go to therapy, which is personal to you, if you decide that you want to disclose that or not. And I know there's a lot of therapists on social media who talk about their own therapy experiences, and kudos to them. That is their personal choice. However, there's probably people, therapists online, who are not talking about it, but also still see therapists. And it's their choice whether or not they want to share that. So I think that the lines could get a little blurry when we're talking about what is the right of someone else to know about that. And it doesn't make you less of a therapist if you're not currently going to therapy or you haven't been to therapy. Um, but also, I think that one thing that might make it a little hard for some therapists to seek out therapy is because we know what happens behind the curtain, kind of thing. It's like a heart surgeon going for heart surgery. It's like, well, why are you doing it that way? And it's a little hard to like let go and let go of the
100%. 100. I feel like you just like, I feel so bad because like, but by the way, I'll give you guys another secret behind the curtain thing.
reins.
One of the scariest things on earth for a therapist is to have a client that is a therapist.
Yeah,
It's
it is.
I'm sorry, so underrated. And I'm going off script here, but like,
Mhm.
it's so scary. You feel so judged. And you want to know why? Because you are
Yeah.
judged. Like, we can't help it. You know what I mean? At the end of the day, we have high standards. We know what we think should be happening, how it should be happening, why it should be happening. And when the therapist we're talking to is not doing that, we're like,
Side
okay,
eye.
no. And then it's really hard to find someone that you feel comfortable with and that you think is good. I mean, yeah, it's it's definitely It's definitely a tricky one. I will say also this, just for everyone to know, I think for clients who are potentially sitting here thinking, what do you mean? Like, how do you go through all of these stories and situations and not have someone to bounce it off of and have a therapist? That's why we have supervision groups. We have
Mm-hmm.
supervision groups, which is like groups where multiple therapists and professionals come together. We hear each other's client stories without breaking confidentiality. We don't give names or whatever. And we talk about different scenarios that maybe we're questioning how we're approaching it, or we want better ways or ideas of how to approach something. Or, sometimes I'll call Steph and I'm like, okay, I just had this situation. Hold me accountable. Did I do something wrong? Like the person reacted in a way that threw me off. Could I have done this better? So we definitely, again, an ethical therapist will hold themselves accountable, go to supervision, talk to colleagues about it. I think the therapists who are going to therapy who are not going through their own emotional stuff, it may be that they are having a hard time with the balance of like carrying their client's stuff outside of session. But then again, you have therapists that are just going through things in life the same way that you are, that are going to their own therapy to deal with that, to take care of that, the same way that doctors still have to go to doctors when they have something going on. And so it doesn't mean any more or any less of a therapist if they are or aren't going to therapy.
Totally. Rachel, why don't therapists give direct advice? I know you're very passionate about this. We've talked
I'm
about this before.
so passionate about this, but I'm also very passionate about this because I don't think it's so simple.
Yes.
So I think one of the things that even got this podcast to start happening was this question right here, where I was like, but sometimes you got to just tell clients like a piece of, information. Here's where I struggle. Okay, to answer the question, the reason the therapists don't give direct advice is, for multiple reasons. Number one, who on earth are we to give you advice with what to do with your life? And I wholeheartedly believe that. Like, we're nothing above you, we're nothing better than you. We are definitely not the masters of your world. You are the master of your own life, of your own world. It's up to you to figure out how to do that. We're here to help you navigate how to steer your own ship. Okay. That's number one. Number two, can you guys imagine if we gave you advice, it did not go the way you wanted it to go, and now for the rest of your life you're going to resent the therapist who told you to do something that you shouldn't have done? Like, that's probably not going to go so well. So that's another reason we do not give advice. The other reason we don't give advice is because it's not helpful to you. We're not here to make you reliant on us. You have to learn to think for yourselves, to make decisions for yourselves, and really learn to navigate your own life, so that we're not, I don't want to say training you, but like we're essentially prepping you to not need us, to be able to make those decisions, to be able to do that on your own. So we're trying to give you all the guidelines and all the tools and all the skills and all the things to be able to figure out the advice for yourself. Here is where Rachel has a really hard time with this. I work with a lot of clients who have been through really bad trauma or really bad abuse, or just like horrible upbringings or situations where, I don't want to say they don't know any better, but in certain situations they don't know any better. Or like the therapist is supposed to ask questions for you to help you have your aha light bulb moment to get to the realization of what to do on your own. And some clients, in my experience, they never get there. And I'm like asking all the questions and they're just like not getting it. And so I do think this is where, I don't want to call it advice, but I think the very, very thin line between advice and psychoeducation is what it is. It's a very thin line, because sometimes I have to sit there and flat out explain to somebody, this is abusive, this is unhealthy. And so if you can leave the situation, let's navigate how to do that if that's something that you want to do. So if you want to call that advice, then, be what it may, like, okay, this is where I struggle with it. But I think a lot of the time therapists will just put that under the category of psychoeducation. But at the end of the day, the person hearing it might take that as advice. So I don't know, Steph, I would love to know, and I know we've talked about it, but in this context, I would love to know your thoughts and your opinions. And clients, I would love to know your thoughts and your opinions. But yeah, I think sometimes clients just sit there and they're like, I understand that you're guiding me. I understand that you want me to come, but I'm lost right now. And like, I need a little bit more guidance than what do you think you should do? And what do you feel about this? Because sometimes people have just been manipulated and harmed and abused in so many ways that they aren't able to get to that point. Or like with my teens,
Mhm.
call it advice, call it whatever you want. I'm going to tell my teens, hi, please do not get like insanely drunk every single weekend of your life. Like,
Mhm.
is that not advice? You know what I'm saying?
Yeah.
Like, where do you draw the line? And so
Yeah.
I do think, and I'm sure I'm going to get hate for this. I'm sure there are therapists who disagree with me, but I do think that there is part of it where, depending on the situation, on the age, on the person, a level of mentoring or coaching or whatever comes into a degree, but you try to make it as little as humanly possible of like your opinion on something or what you feel you should do to navigate this person's life. It's based
Mhm.
on what they're telling you. And like, for example, I'll have a client tell me the 20 million reasons why she hates the person that she's dating. This is the most unhealthy relationship in the world. And then she'll be like, but what do I do?
Yeah.
And I'll be like, well, what do you think you should do? I
Mhm.
really, I don't know. And I'm
Mhm.
like, okay, well, do you think this person's going to change? No. Do you think they're willing to change? No. Are you willing to be in the situation still? I don't know. What should I do? And this will go on for literally months.
Yeah.
And at a certain point, I will say something along the lines of, based on all of the things you've said to me, it really sounds like he's an L parrot. He's this and he's this and he's this and he's this. And you've expressed that you're really unhappy and you've expressed it. So, what do you think about not being in the relationship? What do you think about potentially moving forward or moving on from it?
Mhm.
So, that's not me telling them what to do.
Yeah.
That's me offering an alternate route that they did not think about without telling them to do it, but telling them to explore it when they're not coming up with that on their own.
Mhm.
And Steph, feel free to disagree, feel free to call me out, but that's my thoughts on it, which I think is really not agreed upon by everybody, but that's my
Mhm.
personal thoughts.
Yeah, well, I would agree with you on I would say every point that you had made. That's absolutely something we're not. One point that you started out with that I think is really important to go back to, it's we are here to help you, train you. Like, I know you use the word train, but for lack of a better word, we're going to keep using that. Like, train you how to think, not what to think. And I think that in a lot of our world, the school system, I see that a lot in therapy, perhaps if we're kind of going through the old routes of how we might do things. We want to make sure that we are helping you learn how to be thinking so that you don't need us and you don't need someone to be like,
Mhm.
okay, well, 2 + 2 = 4. No, we want you to understand that on your own and be able to bring yourself to that on your own. Sometimes there's guidance that's needed. Sometimes, I mean, I've definitely had stories like you are explaining, Rachel, where it's like you're giving me all of this and yet you're like, I don't know what I need to do or anything like that. And a lot of times this might also not get me anywhere, but sometimes I'll be like, based on what you're telling me, and the way you're presenting it, I think you do know, you just don't want to admit it to yourself or you don't want to say it out loud. And a lot of times they're like, yeah, that's it. Like
Right.
they
So
really are.
I'm talking about when we're past
When
that
that's
point. I
past
agree with
that,
you. I
yes,
agree with you. That
yes,
like we have that moment of, that's the months where we're trying to like suck it out of them first.
right, right. But understood. Like when you're
Yeah.
saying that it's like after that, and it's like no matter what, I'm showing wood or drink, wood or drink. At some points, you need to change your hat and be like, listen, this is not healthy. It's not. This is something that we need to be really working on. And I think that really is psychoeducation, and maybe people might interpret it as advice. But I think it's ethical and the only ethical thing to do, that if that person's not getting there on their own, no matter what we do, that we do step into maybe a little bit of a different role to really guide them in a different way.
Hmm. Hmm. And, I've had, again, I talked about this a little bit more with like younger clients, but I've
Mhm.
had people who are in really unhealthy situations or coming from really unhealthy situations, and they need someone to tell them, hey, that's not really okay.
Mhm.
They don't know. They're never going to get to that conclusion on their, they don't, this is all they know.
Right.
And so, yes, that's not advice, but like someone can argue you're giving your opinion, but then
Mhm.
that becomes a more of a philosophical conversation of, do we have universal right or wrongs, right? Do we have an ethical code? And so if you see somebody punching somebody else, is it your personal opinion to go over and say, hey, that's wrong, don't do that,
Right. There's
right? So if I
objectivity.
see my client being punched or punching themselves and they're not getting the hint that that's not okay, at a certain point I'm going to like verbally lower their fist and say, this isn't okay. That's
Hmm.
the best way that I can describe it.
I think that's a great way to put it.
But I would love to hear clients, therapists, specifically on this question of therapists giving advice, education, guidance. What are your thoughts? I would really, really, really love to, with a completely open mind, hear what other people have to say and what other people think about this. But on to our next question. Stephanie, do you think that therapists Google their clients?
Well, they shouldn't. I mean, that is a big no-no. Um, do I think that possibly it's happening? I'm sure there are some therapists who do, and that's very unethical. And there's a lot of issues with that. But just like with any field, I always say that you can have a million great apples, but there's always going to be a couple bad ones or a couple ones not doing the right thing. So as a whole, I really hope that that's not happening. That is a hard line for me. I'm sure for you as well, Rachel, because there's a lot of issues. That one, it breaks HIPAA compliance. It violates confidentiality because there's a reason why the systems that we use are HIPAA compliant and created to be in such a way where it's just encrypted that no one knows that, or no one can trace back. Like, let's say someone went into my Google history and noticed I looked up a certain name, then they might be able to look through and be like, oh, well, there's reasons why we want to keep that out. But separate of that, and just like the technicalities of all that, it would be really problematic if I started Googling clients and maybe came across some things that it's like it helps to inform me, and maybe it even could be helpful. But at the end of the day, when I need to go off of what my clients are sharing with me,
Mm-hmm.
because if all of a sudden I have something in the back of my mind that I'm like, I'm waiting for them to share, or I'm like, oh, I know you do this, or I know this happened, that's a real problem. And that's something we can't remove ourselves from, where I'm all of a sudden wanting to treat you in a way that I think you need to be treated separate of what you're presenting to me. So that's an issue. Let's say if you went back and all of a sudden when you Google them, a Facebook post from 2014 shows up, which does not indicate anything that they are today and might not have anything to do with something that led them to this point. Then we're like, oh, well, we're looking at the wrong direction. And I think that there's so many issues with potentially Googling your clients. I'm not saying that there's not a temptation, because we are human. I think that, yeah, it would be probably something that we might be inclined to want to do. Like someone says something like, oh, I was involved in this. I'm like, oh, that sounds so interesting. Like maybe I want to look into it a little bit more. You just can't. And it's just a hard line that I would encourage any budding therapist, any future therapist, any current therapist to not cross it, because that could be so dangerous. Now, I'm not saying in a physical way, but in an ethical way. It's just very problematic. It's not good.
Yeah, nothing to add to that. That was perfectly said, stuff.
Thank you. I guess I'm very passionate about that.
Yeah.
All right, Rachel, how much do therapists really know about me from my first session?
Well, that depends on a few things, and that's actually a little bit more of a complicated answer. So, first of all, that depends on how a therapist conducts their first initial session. I generally get a lot out of my first session with my clients, but that's also because I've been blessed enough with clients who trust me with their stories. And when we're getting to know clients in the first session, some are more closed off, some are more open. Some people will just sit there and start telling you their entire life story with barely even asking them. And a lot of it depends on that. Now, I try really hard not to, start diagnosing in my head or coming up with assumptions or coming to conclusions based off of a first session, because honestly, That's not how we do our job. And if a therapist is doing that, they shouldn't be, because if you think you have a whole person figured out after one session, that says more about you than it says about them. Now, I do think there are certain patterns that we can notice really, really quickly. There are certain things that we could pick up on that will tell us how to navigate future sessions, or how this might go, or what this might look like. Like, I'll tell you guys a humongous secret, but do not tell anybody. When I work with couples, a real telltale sign to me of how this is going to go is if I have one person willing to do the work and the other person only pointing fingers at the person sitting next to them instead of looking in the mirror and being willing to do the work on themselves. If I'm working with a couple and both people are not sitting there and willing to do the work and willing to look in the mirror and say, what can I change and what can I improve and what am I doing wrong? And they're just pointing fingers at the other, that's going to tell me a little bit about what the work is going to look like, and potentially how it's going to go. When we hear certain sentences said by a client that will, give us a peek into their self-esteem, their relationship with their family, their upbringing, their attachment style, certain traumas that have come up, we obviously are all of a sudden like, okay, that's something that has to be starred. That's something that has to be starred. That's something that has to be starred. But we haven't had you all figured out in the span of 45 minutes to an hour, and it doesn't matter how professional you are. Like, you need to believe that humans are more complex than your brain hearing their story in 45 minutes.
Yeah. That really hits every point that I would. The only thing I would say to add to that, or just to put it more succinctly for myself, we are getting like a little bit of an outline of the picture, and throughout the entire time from start to finish, we're going to be continuing to fill in that picture. It's an evaluation period. I hate to use such an intimidating word, but for lack of a better word, we are always learning, because we're also changing as human beings as well. So when we are always getting a guidance as to what we're learning about them to help us in the future, but also always open-minded to adjusting that picture, that is really the key in therapy, I think, when we're learning about a person.
Yeah. So, Steph, what do therapists talk about with each other when we are not just necessarily in supervision, which I think we've covered a little bit, but in general, what do we talk about?
Well, we are human. So I know Rachel and I, we literally probably have had a conversation about like anything you could possibly imagine. And opinions on things, on the world. We've talked about our family lives, our friendships. I mean, we're just like you. We are just human beings who are navigating the world just like anyone else. Anything that you talk about with your friends, we probably talk about as well. Perhaps if we want to put a little bit more of a therapy spin on it, sometimes we talk about how we might approach certain things in the therapy world, or how we're learning about something and having a little bit of an issue with something that is just like mass accepted by the therapy world, which is why we literally started this podcast, is to have a different voice and maybe a more honest voice than sometimes what we're seeing. So that's a really hard question to answer. And it's just like literally the same as anyone else, I would say.
Yeah.
Do you have anything to add?
If the question is about like specifically what do therapists talk about that is in regards to the therapy space or our career, we'll complain about notes. We'll talk about what different platforms that we're using to help us write notes, or follow HIPAA, or
social media.
How are we charging clients, or insurance sucks, or do we stay in private practice? Do we expand private practice? Do we become supervisors? Have you gotten this type of specialty? Have you heard of this new modality? It's, it like anything else, I think like any other career, we're talking about the intricacies and the technicalities of our job. And sometimes that's in a positive way. And sometimes we're complaining because, every job has something to complain about. And that's really it, and then depending on your relationship, like Steph and I are very good friends. We will talk about everything under the sun. So I hope that answers the question, but
you did such a great job.
So just to wrap up and go through a few key takeaways, it is normal to have curiosities and even fears about therapy, especially if it's your first time. But therapists are human. We have boundaries, but we also have feelings and real reactions, thoughts, opinions. We're people, just like, anybody else. And asking your therapist these questions directly can strengthen the relationship. So don't be scared to approach your therapist and ask away.
That brings us to our listener's question. If you guys want to ask us a question, you could send over a question to be featured potentially in one of our next sessions. You could send it over to our Instagram at Coffee and Counseling Podcast or email it to us at coffeeandcounselingpodcast@gmail.com. So today's listener's question is, why do I attract emotionally unavailable people even though I say I want more? And to that, my answer would be check out our last
I was about to say
about attachment styles. I think that would be huge. And maybe just being really honest with yourself about what context you're meeting these people and maybe what patterns are showing up early on that might indicate that these are the situations that you keep ending up in.
And I'll leave you with a homework for whoever asked this question. You say, why do I attract emotionally unavailable people even though I say I want more? I would ask you this. If you got more, what are you scared is going to happen? That will probably answer your question for you.
Great question. Okay, so thank you again for tuning in to our session today. For our listeners, we encourage you to reflect on what question have you always wanted to ask a therapist but never have, and send them over to us. Maybe we'll have another session or a couple of these to answer some of your questions. If you are knowing anyone who's therapy curious or therapist curious, please share this session with them and get their thoughts on it. Anything we talked about today will be linked in our show notes, and we hope you join us again for our next session on Tuesday.
Thank you for being here. Have a great week, everybody.
Thank you so much for being with us today. Please follow our Instagram at Coffee and Counseling Podcast and send any questions you have about any topic to us via direct message for a chance for your question to be featured in one of our next sessions. You can also email us your questions or topic suggestions at coffeeandcounselingpodcast@gmail.com. Make sure to check out some of our other sessions available to you right now. Once you drink up all of those and your coffee, come back next Tuesday for our next session.
The information shared in this podcast is for educational and informational purposes only and does not constitute therapy or mental health advice. Listening to this podcast does not establish a therapeutic relationship between you and the hosts. If you are in need of support, we encourage you to seek help from a qualified mental health professional. This podcast is not a substitute for individualized care. We do offer individualized therapy. If you're interested in individual therapy with one of us, please visit our practice website and send us an email to set up a free consultation call. All of the links and our contact info will be in the show notes.